Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on pharmacokinetics and pharmacodynamics, receptor binding, each with 4 answer choices and detailed explanations. Vignette 1. Affinity vs. efficacy. A new drug binds tightly to beta-adrenergic receptors but produces no cellular response. Which term best describes this drug? A. Agonist. B. Partial agonist. C. Antagonist. D. Inverse agonist. Answer C. Antagonist. Explanation. An antagonist binds with high affinity but lacks efficacy, meaning it does not activate the receptor. Vignette 2. Dose-response curve. A drug shows a rightward shift in its dose-response curve when co-administered with another agent. What kind of interaction is most likely? A. Competitive inhibition. B. Non-competitive inhibition. C. Irreversible binding. D. Increased metabolism. Answer A. Competitive inhibition. Explanation. Competitive inhibitors shift the dose-response curve to the right, indicating higher doses are needed to achieve the same effect. Vignette 3. Full versus partial agonist. Drug A is a full agonist at the mu-opioid receptor. Drug B activates the same receptor but produces only 50% of the maximal response. What best describes drug B? A. Antagonist. B. Inverse agonist. C. Partial agonist. D. Allosteric modulator. Answer C. Partial agonist. Explanation. A partial agonist binds to the receptor and produces submaximal response, even at full receptor occupancy. Vignette 4. EC50 definition. Which parameter is defined as the concentration of a drug needed to produce 50% of its maximal effect? A. ED50, B. EC50, C. LD50, D. TD50. Answer B. Explanation. EC50, effective concentration 50%, is a measure of potency indicating the concentration needed for 50% of maximum effect. Vignette 5. Therapeutic index. Which of the following best reflects a drug with high receptor specificity and a wide therapeutic requires dose titration? B. Has high toxicity risk. C. Has predictable dose response. D. Frequently causes idiosyncratic reactions. Answer. C. Has predictable dose response. Explanation. High receptor specificity and a wide therapeutic index are associated with predictable effects and lower toxicity. Vignette 6. Spare receptors. A drug reaches maximal efficacy even though not all receptors are occupied. What concept does this illustrate? A. Downregulation. B. Desensitization. Spare receptors. D. Tachyphylaxis. Answer. Spare receptors. Explanation. Spare receptors allow a full response to occur even when only a portion of receptors are bound, enhancing sensitivity. Vignette 7. Receptor downregulation. A patient using a nasal decongestant develops tolerance over a few days. What is the most likely mechanism? A. Enzyme induction. B. Increased bioavailability. C. Receptor upregulation. D. Receptor downregulation. Answer D. Receptor downregulation. Explanation. Repeated agonist exposure can cause receptor downregulation, reducing drug response, tachyphylaxis. Vignette 8. Inverse agonist. Which drug type binds to the same receptor as an agonist but produces the opposite effect? A. Antagonist. B. Inverse agonist. C. Partial agonist. D. Allosteric enhancer. Answer B. Inverse agonist. Explanation. Inverse agonists bind to the receptor and stabilize it in its inactive conformation, reducing baseline activity. Vignette 9. Potency versus efficacy. 2 drugs produce the same maximal effect, but one requires a lower dose. This difference reflects A. Efficacy, B. Potency, C. Bioavailability, D. Volume of distribution. Answer B. Explanation. Potency refers to the amount of drug needed to produce a given effect. Lower dose equals higher potency. Vignette 10. Receptor types. Which of the following receptors produces the fastest cellular response when activated? A. G-protein coupled receptor. B. Ligand-gated ion channel. C. Nuclear receptor. D. Tyrosine kinase receptor. Answer B. Ligand-gated ion channel. Explanation. Ligand-gated ion channels mediate immediate changes in membrane potential by altering ion flow. Let me know